All right, good evening. I believe we are just live. This is United Medical ACO, our diabetes program. This is our monthly, bi-monthly or bi-weekly event. Today we are going to have a different topic. Good evening. Okay, so I was just confirming whether or not we were live. So again, with the Wednesday Wellness webinar, our goal is to reach out to our diabetes patients with diabetes who are struggling managing their conditions. And in some cases, we have different specialties who are coming into this event to cover their specific topic. Just to kind of start introducing our program members, and then we'll start the actual panel discussion. So, well, Donna, you are actually already there, so you can introduce yourself.
Yes. Hi, good evening, everyone. My name is Donna Gunkel. I am the Director of Clinical Integration. So I oversee our wellness programs as well as our care coordination, care management teams.
So as our program director, Dr. Ripu Handal from First Aid Endo, he is running the program with us. Tim McCoo from the physical therapy, and of course, Caroline Weber as our dietitian, and Roxana Portlank is also joining us time to time for the social worker update. So today's panelists, Caroline, of course, as our she's running our program from dietitian standpoint, but we do have a special guest today, Dr. Brian Calhoun. So I'm going to actually stop presenting here, and I'll ask them to introduce themselves. So Caroline, we can start with you.
Hi, I'm Caroline Weber. I'm one of the dietitians on staff for United Medical. We work with various patients with various medical histories, specializing in those with diabetes as well.
And Dr. Calhoun?
I'm Dr. Brian Calhoun. I'm a general dentist in the Wilmington, Delaware area. And I'm just happy that you guys invited me to come on and speak with you.
Well, thank you for joining us. So I think the oral health is important, but it's even more important for patients with diabetes. We do see this like from the personal standpoint with our family members who may have diabetes, and it's a challenge. And sometimes it's kind of, in some cases, it's not being taken care of. It's kind of like the afterthought. And I think that we were thinking that this would be a timely to present what's happening with oral health. Of course, Caroline, it was a big factor to bring you in, and thank you for joining us. So, Caroline, if you want to say something before we start, I don't want to cut you off. So.
Oh, no, I'm good. I'm just super happy that we're all about prevention on this side. Anything we can do to help prevent going full blown into the diabetes realm, but also for any kind of education we can provide for our patients to help them and provide more tools for them in the diabetes diagnosis, because there's a lot of different areas. So it's helpful to have different specialties. So we're super happy to have you on.
Thank you. So I guess I will go into it now, if that's okay.
Mm-hmm.
Go ahead and share my screen here. All right. Can everyone see that okay?
Not yet. Yes, now we are good.
Put this in presenter mode here. All right. So starting with my slides here, I will just want to give a brief overview of the objectives that I'll be talking about today, starting with just a little brief overview of what diabetes is, and then bringing that into how it affects your dental health and oral hygiene, and kind of give a brief overview of the different types of gum disease, including gingivitis, periodontitis, and then finishing it off with some preventative and maintenance techniques to help, keep pure oral hygiene at its best. So going into it first, just a little overview with diabetes. So diabetes obviously is a disease that disrupts the regulation of your blood sugar. So looking at this little infographic here, you can see that you consume some food, it gets broken down in your GI tract and stomach and releases, gets broken down into its, basic form, specifically glucose in this instance, and that gets released into your blood. And then once it is detected, it is the beta cells in your pancreas release the insulin, and that basically tells your other cells in the body that, hey, there's sugar in the blood and we have some energy that you can uptake. And then the cells in the body will start to uptake that blood or that sugar from the blood, reducing the levels. And then so where there are two different types of diabetes. Type 1, we can see here, is an autoimmune issue where your body destroys its beta cells and no longer can produce insulin. So that's why we call it insulin dependent, because you need an external source of insulin in order to regulate your blood sugar. This typically happens, we detect this early on in, usually adolescents, children, and it's a rare, about 5% of cases. The one we see more often is type 2 diabetes, and this is where the cells of your body become resistant to the insulin, and therefore, also same kind of result where you're not able to regulate your blood sugar levels, but it is not insulin dependent. You don't necessarily need to have an external source of insulin, but we typically see this later onset in adults, and it's, the majority of our cases, about 95% of the cases. So having an understanding of what diabetes is and the different types, we can also break it down into some of it, or once we know about diabetes, we can also see some of these long-term complications with diabetes, specifically breaking it down into microvascular and macrovascular. This is basically small blood vessels. Macrovascular is your large blood vessels. And you can see there's all sorts of issues and complications that can arise from long-term diabetes. Specifically, the one I want to focus on that has to do with dentistry and oral hygiene in particular is this periodontal disease, and we'll kind of go into what that is in a little bit. But one thing I want to point out, so hyperglycemia or high blood sugar has been shown to be a key factor in some of these long-term complications. And, long-term or chronic hyperglycemia or chronic high blood sugar can make these things worse or, have them present themselves. So it's very important to maintain a normal blood sugar level in order to help minimize the complications or at least, prevent them from coming about. So that is where we'll bring it into what is gum disease and periodontitis, and what does that all mean. So gum disease can kind of be generalized and broken down into gingivitis, periodontitis. These are two of the main forms of gum disease. Many people are familiar with or have heard of gingivitis before, maybe not so much periodontitis, but hopefully we can give you a little breakdown of what all that is. So you can see here, we have a healthy tooth cross section. Yeah, we have it, bone surrounding the tooth. We have the gums coming up right to the base of the crown of the tooth here. And this is what we expect to see in a normal, healthy individual. And then once we start to get into gingivitis, this is where we have some of these inflamed gums. We can see they're, starting to turn a little bit more red. You can see this looks like a little 5 o'clock shadow around the tooth base here. This is actually plaque. So all these gum diseases arise because of bacteria, which is, plaque. Plaque is basically bacteria, food debris, things of that nature that get stuck on your teeth. That's why we brush them every night, to get all that plaque and build up off of there. But if left on for longer periods of time, eventually, they start to get inflamed. Your body's immune system isn't happy that there's a foreign body on the tooth, and they can bleed, they can be painful, and left on there for prolonged periods of time without any brushing or intervention. Over time, we end up getting a more severe form of gum disease. So once we start to get breakdown of the bone tissue, the gum pocket gets a little bit deeper. We start to see some recession on the tooth. And in general, it's just not a very good situation here. This is to get into periodontitis classification. So sometimes as dentists will go around and we measure with a little probe in your gums. It's not a very comfortable experience, but as this is what we're measuring the gum pocket here to see if there's recession and increased bone loss. And if given enough time, we can get even more advanced periodontitis where there's more breakdown of the bone. Sometimes the roots are even more exposed here. The teeth start to get a little bit mobile. And eventually the end product of this will be loss of the tooth or teeth in general. One thing I want to point out here is gum disease is typically, it's caused by bacteria as the main component, but diabetes is definitely a factor. It's a contributing factor in either making this happen at a increased rate or it getting worse significantly quicker. You can think of gingivitis and periodontitis as kind of like a wound in your mouth. It's kind of like a sore that's, it's constantly bleeding, inflamed, just like one that would happen if you got cut on the outside of your body. This is kind of one that's just on the inside of your mouth. So you definitely want to, you wouldn't want bacteria and things of that nature in a cut on the outside of your mouth. Same thing with the teeth on the inside here. We want to keep them nice and clean. So that way we can prevent this in the first place. So, and this is a very prevalent disease in the United States and the world in general. Almost 50% of the people, of adults in the United States have some form of gingivitis or periodontitis. And some don't even realize it or going around undiagnosed. So it's very prevalent. It's very, it's not something that only a few people have. It's very, out there. And a lot of times, you can be walking around without even realizing it because it's not necessarily painful, although sometimes it can be. But that's why it's definitely something, go to the dentist regularly, get checked out, make sure you are, doing the right things here. But let's say you do go to the dentist and they tell you you have gingivitis or periodontitis. So what are they going to do to help treat that? Usually we start with a non-surgical approach first. So scaling and root planing can be seen down here. You got our little metal hooks in here. These are everyone's favorite. But basically we, want to remove that plaque and that buildup, that tartar or calculus, as we call it. And so that's the scaling portion where we go in, we remove all that bacteria, all that source of all this inflammation. And then root planing is where we smooth out the surface because a lot of times it's very rough after having all this buildup sit on there for a while. And that gives a nice clean surface for the gums to reattach to and, has a nice hygienic aspect to it. We also might bring you in more often for more frequent cleanings. Instead of every 6 months, we might bring you back every 4 months or 3 months, depending on how severe it is. And then there's also antibiotic rinses and vectors that we can use to put into the gums to help reduce that bacterial load. And if that doesn't work, that's usually our first line of defense, but sometimes we get some more advanced cases where we might need to go in and get a specialist involved. A periodontist is a gum specialist. They work with these special procedures where they go in surgically, take the gums away, clean it up even more, especially when you get into that very severe recession where the buildup is very deep down, and it's not easy to get to with just typical, non-surgical approaches. There's laser surgery, which sounds very fancy, but it's basically just removing that inflamed tissue and creating a nice hygienic environment. And then grafting can come into play with, fixing some of that recession for aesthetics or for bone grafting. In bone grafting's case, sometimes there's defects where there's little pockets that go all the way down. We might want to put some bone in there to help build that back up. So it's a lot easier to keep clean, especially in molars where we get these the bone down here underneath this, what we call furcation. It's very hard to keep that area clean. Sometimes we want to put some bone around that area, around that tooth to help keep it so stuff's not getting underneath there. So yeah, so what do we do? So we've treated it or we want to prevent it. What's the best way to do that or keep it at bay? And this is very simple, you know, everyone's probably heard this before. We, you know, want to keep up on our oral hygiene. So we're flossing every day using an oral rinse, preferably one with fluoride is always good. That helps keep the cavities at bay. That's another dental issue, but definitely fluoride is a good option for that, you know, remineralizing those teeth. And then brushing twice a day with a soft bristle toothbrush. We don't want to push too hard. A lot of people brush actually too hard. We just want to get that bacteria and stuff off of there. And then going in for your regular dental cleans, whether that's every 3 months, 4 months, or 6 months. And then going into some more oral hygiene. One thing I like to stress to my patients is doing good oral hygiene technique. So up here in this top right-hand corner, you can see we have a toothbrush at a 45-degree angle. And we're kind of brushing in a circular motion here. Don't be afraid to get in there and brush the gums and get up underneath teeth and everything like that. Like I said, we're just trying to get all that plaque and bacteria away from the teeth, keep it nice and clean. And this is a good way to do that. With flossing here, these are great. I use these myself, the floss sticks. But we want to make sure we're getting down past, you know, this helps break up bacteria and plaque in between the teeth. And we want to make sure we're taking it all the way down underneath the gums, following the contour of the tooth on both sides. And that helps break up all that, you know, bacterial colonies underneath there. For people who have recession, there's these great things, the Proxa brushes here, where you get a little bit of recession, you have bigger spaces between the teeth. Sometimes you need a little bit bigger of a brush or pick in order to get in between there to clean out that space effectively. Water picks are great. My hygienist always recommends them, and you know, you kind of have a joke that she should be getting paid by the water pick company because she's constantly telling her patients that, you know, they should get a water pick. But these are great. They can come in handheld versions like this. I liken it to a power washer for your mouth. You can put mouthwash in here or just plain water, and it kind of power washes the areas that are tough to clean, gets that food debris out of there. Electric toothbrushes are always great, especially for people who have issues with mobility, you know, arthritis, things like that. But even people, you know, with normal mobility, these are great aids as far as getting in there and keeping everything nice and clean. And a lot of these have sensors to let you know if you're brushing too hard. A lot of times if you're brushing too hard, it'll beep at you, let you know it's, you know, pushing too hard. Because a lot of people, like I said, do brush a little too aggressively sometimes. But the biggest thing I want to point out here, is, you know, there's a lot of different dental aids out there, a lot of products. You walk down the pharmacy aisle for dental care, and you know, they've got a whole aisle full of different things that they're trying to sell. But I always like to tell people, look for this ADA accepted logo. This is the American Dental Association's logo for testing products. They go above and beyond the typical just FDA approval to make sure that they are actual good products that will work really well for keeping your, you know, hygiene clean, your oral hygiene, you know, in good order. But yeah, so that is kind of what I wanted to go over. I just want to say that, you know, it's very important, especially with patients with diabetes, to let your dentist know that, so that way we can be on the lookout for any signs and symptoms to try and catch any oral gum diseases early, making sure you're going in regularly for your cleanings and things like that. So that way we are, you know, able to catch that and give you all the techniques and advice and treatment that is needed. So,
you know, listening to you, one of the things that I realized personally is, you know, you can tell, you can see Donna's title is clinical integration. So when we look at the clinical integration, unfortunately, there is a big gap between the medical and the dental. It seems like if the dental is not part of the medical, the clinical integration, and I think with the ophthalmology, we were able to overcome that. So that's part of it. But I think dental is not, Donna, correct me if I'm wrong, but it's not even part of our quality metrics. But for ophthalmology, it is a really one of the, getting the diabetic eye exam is like one of our quality metrics. It's interesting that dental wouldn't, because it has more impact, or maybe it has similar impact in someone's life. And I don't think we are paying enough attention, or we are emphasizing it enough in a way. So because I know many people who are going through diabetes, I mean, the health issues is one thing, but there's also this other, like if they're not taking care of their mouth, even if they do, if the disease is not controlled, there's still some uncontrolled odor coming out. So then they start actually not socializing with people. And then, depression goes hand in hand with diabetes if it's not controlled, and everything is just piling up. And I'm so glad that you were able to join us and explain this. So this is extremely important. Now, I didn't realize that because you are, and I should have, because Caroline is normally from Delaware. She lives in PA, but that's just recent. So if people wanted to reach out to you, I just want to share your website, and I'm assuming this is the right one.
Yes.
I used to work with my dad. It was fun and difficult at the same time. I don't know how your experience is.
Yeah, we have our fun and difficult days.
So your office is right in Wilmington, 4600 New Linden Hill Road.
Yes.
And then they can reach out to you directly from here. So that's, I just want to make sure that people knew where your practice is. And also, like, I think, what we should do, Caroline, Donna, share the information with our physicians. I don't know where the patients are being sent, but it would be helpful to channel them through with someone who's, participating in our activities. So that would be really good. Now, Caroline, go ahead.
Sorry, I was going to ask one quick question while you're on that topic, though, Kemal. So do you see patients of all ages? I mean, do you start with children, or do you only see patients at a certain age and up?
Oh, yeah, we'll see all ages, children, families, all the way up till, 90, 100-year-old patients. So we get them all.
Okay, because I know sometimes people, don't want to see the younger children. So I just wanted to make sure. And you are accepting new patients in all age ranges? Okay.
Yes, we are. Yep.
Okay. Thank you.
I can vouch, they're great.
I know, Caroline, you have a couple of slides, so maybe after your slides, we can just have a little question answer session.
Sure.
So I can share my screen for you.
Yeah, so my section's pretty brief because it's pretty much, I feel like, something we talk about a lot, even outside diabetes care as you grow up. People have told you what foods to kind of stay away from for avoiding cavities and those types of things. And that's sort of kind of where we're going tonight, nutrition-wise. Recommendations are pretty much the same as I would recommend for most patients that don't have diabetes, but the key is diabetes patients have a higher risk of infection and complications in dental disease. So nutrition does actually play a really big role into dental care. It affects our oral health as well as, nutrition affects every other part of your health as well. So no exception with dental health. Specifically, hyperglycemia's impact on oral health, which Dr. Calhoun kind of covered a little bit, which was fantastic. So if your sugar level is high in your blood, it's likely high in your saliva too. So bacteria and plaque and sticky films that cover those sugar filled foods, they'll stick to your teeth and cause tooth decay, cavities, gum disease. So uncontrolled blood sugar can lead to these things listed here: taste change, right? Things might taste different. You might have impairment of taste. You could have salivary gland dysfunction, which means, dry mouth. You're not having as much saliva wash over your teeth to kind of remove that bacteria or control the acidity in your mouth. Gum disease, infection, and impaired healing, which we talked about last month. Diabetes and high blood sugar impacts your ability to heal, the rate of healing, and can cause increased risk for infection. as well as tooth decay. So I just mentioned acidity. So acid producing bacteria are activated by carbohydrates, which we'll talk about in a minute. So when carbs are broken down, as soon as you put them into your mouth, they produce acid byproducts, which can cause harm to your dental tissue. So usually if your pH in your mouth is below 5.5, there starts to be some issues. So we want to make sure that we control the acidity by specific foods. So that we'll find that the type of carbohydrate eaten determines the extent on the impact of your tooth decay. So carbohydrates, which we know impact our blood sugar, right? They're an important part of a balanced diet. So we want to make sure we have a good source of carbohydrates, but there's main culprits in the carb family that can cause tooth erosion and decay. So since we don't want to cut them out completely, what carbohydrates do we want to kind of limit and avoid? Bacteria thrive with carbohydrates, and we know certain types of carbohydrates out there. Any kind of sugary beverage, refined carbohydrates are what we call like those white bread, crackers, sugary cereals. They tend to love to stick to the teeth. So we want to make sure that we limit them as much as we can. The sodas and teas and alcohols tend to be acidic, so it can wear down on your tooth enamel, which can cause, increased risk for any kind of tooth decay. As well as, regular saliva is usually enough to neutralize kind of those acidic on a regular basis, the acidic foods and beverages. But if we have diabetes and dry mouth, or, maybe medication is causing some dry mouth that we're on, in addition to the diabetes, we could run into some issues. So there's a good recommendation is when you're eating, try to limit the snacking of those high acidic sugary foods. So usually some recommendations are eat your meals in one go. You're having less exposure because if we're constantly snacking on those refined carbohydrates, we're having an increased exposure, which could cause some increased risk for us too. So as much as these refined carbohydrates want to limit, we know some of them have some vitamins and minerals in them, like bread has some certain vitamins and minerals and things like that. But we want to make sure if we do eat these, we remove the food particles as quickly as we can. And especially those sticky, chewy ones like taffy, sauces like caramel, barbecue sauce, those types of things that tend to stick to the teeth, making sure that we reduce the time it spends on our teeth. So, but there are some good foods we want to include. Some beneficial foods, next slide, I think. Perfect. So beneficial foods to include, which we talk about these all the time. So you can't go wrong with fruits and vegetables. They have tons of fiber, which helps keep gums clean and gets saliva flowing. Crisp fruits and veggies, like if you bite into an apple, it's got that fibrous texture, so it's less likely to stick on the tooth and can remove any other kind of like plaque that's kind of sitting there. I once heard that eating an apple was equivalent to brushing your teeth. I don't think that's true, but I always wondered if that was true. Yeah. So, I mean, it's got that fibrous texture and it's got some really good vitamins and minerals in there packed into there. So we'll actually cover that in a minute on types of vitamins that these kind of foods provide for us. Same thing with dairy products. So cheese actually helps. Cheese, I'm happy to say this, helps produce saliva. So cheese is good. We like cheese. It has calcium and phosphates in the milk or other dairy products. So we know those are essential nutrients for building bone, for, restoring minerals, maybe lost in tooth enamels that you can help protect the tooth. So dairy products, although some can be acidic, they contain that calcium mineral to help strengthen that tooth. So even those dairy-free milks tend to be fortified with calcium or phosphorus. So it serves as a place to work on bone structure there. Nuts are great. They're full of really good fatty acids. They're lower in sugar, higher in protein and other minerals. They're also pretty dense to chew into, so they don't really stick to the teeth as much. They kind of produce that saliva production, which is great, require a lot of chewing. Your lean proteins like eggs, fish, poultry. Protein we talked about last month is important for repairing tissue. So especially if you have some sort of periodontal disease going on, protein would be a great thing to include so that you have, enough production of healing properties as well. And then we have fiber foods. So with fruits and vegetables, that fibrous food helps that chewing. It usually takes longer to chew those fiber foods, but they produce saliva as well. So we want to include plenty of those. And of course, some sugar-free chewing gum. So if you don't have time to brush your teeth in between meals or snacks, that's a good way to kind of remove some excess plaque, but we want to make sure it's kind of in that sugar-free zone so we don't cause any kind of blood sugar spikes. So swapping out those processed starchy foods we had on the other slide, like white bread, potato chips, for more nutrient-dense carb sources like whole fruits, sweet potatoes, whole grains. Those could really impact oral health by just switching the type of carbohydrate that you're eating. And next slide. So I said that we had fruits and vegetables, different types of carbohydrates. They have great sources of vitamins and minerals. So a lot of the time, breaking it down even further, there's all these components that can, help prevent dental disease as well as support immune function, especially vitamin C. So we know it supports gum health and collagen formation. So it aids in maintaining, the integrity of oral health. So we want to make sure we include a good amount of vitamin C in our diet, whether it be citrus fruits, tomatoes, peppers. I think broccoli and potatoes are in there as well as spinach, great sources of vitamin C. Vitamin D as well, which we know is important for bone health, has calcium and phosphate. It works with that metabolism in the mouth. So we want to make sure that we get a good source of vitamin D because it helps with that enamel remineralization. So if you have that wearing down of your enamel, vitamin D is a really good source to include in your diet. You can mostly find it in salmon, eggs, cheese, milk, definitely fortified products out there too. I believe some milk substitutes also have that vitamin D added in. B vitamins, which are great for what we call epithelial cell turnover. So replacing dying cells with new cells. So it's great for healing. So we want to make sure we include a good amount. Usually you can through leafy vegetables, milks, eggs, beans, any kind of meat product have great sources of B vitamins. We have zinc, iron, we got vitamin A and omega-3 fatty acids, all important in mucosal and connective tissues and immune system support. So if you're at high risk for infection, these are great ones to include. Also can help with those omega-3s, limit that inflammatory response in the body. So shellfish, cashews, meat products, fatty fish, and nuts are great sources for all of these. And of course, calcium and phosphorus, important for what we said, bone mineralization, creating strong bones and teeth. Usually calcium you can find in tofu, dark leafy greens, milk, vegetables. Phosphorus is what you can find in, eggs, meat, dairy, beans. So basically a well-rounded diet of all different varieties can provide you with all these vitamins and minerals. And then our next slide. This one's kind of on the newer side of research. So probiotics normally are associated with gut health, but studies have shown that they may reduce the risk of gingivitis, plaque, and gum disease. So creating that good bacteria environment to reduce your risk has been shown in some good studies out there. So you can get that from taking a probiotic pill. You could eat yogurt on the regular basis. And then even I think there's like sauerkraut has great, bacteria in it as well to support good overall gut health, but it helps that gut bacteria to flourish. So good bacteria can help support your overall dental health. Big word of anthocyanins, which are basically a fancy term just for a compound that has a lot of antioxidant properties. So you could find this in cranberries, other kinds of berries, red cabbage, and raspberries are a big one. So it can help eliminate cell damage. So we want to include tons of antioxidants as well, and polyphenols, which are basically another term for another type of compound that acts as an antioxidant to protect the body from cell damage. So green tea, I know, is a great source of polyphenols. You can find it in other kind of plant foods as well. While a few micronutrients are particularly helpful in bone function and dental health, specifically, these micronutrients are related. These micronutrients are important for overall health, including dental health. So it's not just, these are the ones to take, it's all encompassing. So it can help support good health overall. So a quick summary on our end is maintain a good blood glucose to reduce the risk of dental complications. We know that when your blood sugars are in good range, a lot of complications and risks are decreased. So maintaining that good oral hygiene with regular checkups, brushing teeth daily, as well as focusing on a nutritious diet rich in fruits, vegetables, whole grain, lean meats, and limiting those riskier foods, or brushing right after or rinsing right after of those sugary, sticky foods that tend to hang around for a while. But as always, we're a team that works together, so you can work with all different professions who have different insights. So if you have questions on dental health and nutrition, you can consult your dentist, you can consult a dietitian. We all work together to try to hopefully prevent it, but if not, work on treating it together.
All right, so we are back to the regular form. So, well, thank you, Caroline. Now, Dr. Calhoun, I don't know if you, sometimes when I'm presenting, when I'm doing the hosting part, although I do want to pay a lot of attention, I may miss some stuff because I'm looking at the technical stuff and then checking other stuff. Maybe you already mentioned this, but we mentioned like the dental health. So the tongue is part of the dental, part of the oral health, actually.
Yes.
So is there something to, what's the best way to clean the tongue?
So yeah, that's a great question. You can be as simple as just taking your toothbrush and kind of brushing off all that, biofilm on top of your tongue. They make special tongue scrapers, which are really great. It kind of looks like a little plastic rake or something that you can scrape on the top of your tongue. And basically that's just, you're using some mechanical force to basically get rid of all that buildup on the top of your tongue, which is really good. It helps keep your breath much cleaner and, keep your tongue nice and clean and fresh. So it's a great question. So
does this affect the patient with diabetes more than the others? Because there's, I have experienced this with some friends, family members, where the breath can be really heavy in some cases. Is it just from the dental part of it, or is it from the tongue as well?
It can be, from kind of multi-factor, come from both. But as long as you're keeping the oral cavity clean, doing a good job of keeping up with your oral hygiene, that can definitely help keep down some of that, halitosis, the bad breath smell and things like that. And then obviously keeping your blood sugars regulated is definitely a big factor in keeping your overall health in, good terms. But so it's kind of multi-factor approach there that you want to come from.
Let's see. Donna?
I'm trying to think. I asked my question earlier, but I do have a question. So I know a lot of people ask us like how often. So what age should someone start seeing a dentist, and is 2 times a year usually still the regular interval that you would want to treat with your dentist?
Absolutely. We always recommend usually starting at around the first year of life, around age 1, maybe not necessarily to get a cleaning or anything like that, but just to get familiar with the office. And usually around, 3 is when we start trying to incorporate some cleaning techniques and things like that. But 1 is a great age just to, come in. We can help talk to mom and dad about, different techniques about, what to avoid, what to do, especially when they start teething or, getting those first couple teeth. So, and then as far as intervals, usually 6 months is kind of still the standard. But like I said, if, there's other factors that might make you want to come more frequent, but typically 6 months is the probably the longest you'd want to go.
Okay, thank you.
Mm-hmm.
I have a question. So age-old debate about electric toothbrushes versus a regular toothbrush. For patients with diabetes, would you recommend going to an electric toothbrush, or do you think a regular toothbrush will still work just as fine?
You can make a regular toothbrush work, but there's a lot more technique and manual dexterity involved. So the studies have shown that you can do just as good a job cleaning with a manual toothbrush, but it's not necessarily as easy as it is with an electric toothbrush. So I always recommend electric toothbrushes for all my patients that ask, just because they are a lot easier. They've got that cool technology, to tell you if you're brushing too hard. They have timers in them to let you know how long to brush for, because I know sometimes people like to skip out and not do the full 2 minutes. But the electric toothbrushes are definitely a great option for not just people with diabetes, but everyone. I always recommend them. Yeah.
And one thing you didn't really talk about, but oral health overall, but what about rinses or mouthwash? I know we kind of mentioned it
Yeah,
a little
kinda.
bit once, but what, I mean, are there ones that you recommend over others?
Like I said, anything with that ADA accepted logo is definitely a good place to start. Anything with fluoride in it, fluoride is really good chemical that helps remineralize teeth, like especially for teeth that are starting to get some decay in them. I know I didn't really talk too much about decay, kind of focus more on the gum disease aspect, but when you're having teeth that are starting to get those pre-cavities where they're not fully cavitated yet, the fluoride can actually come in and help remineralize the outer enamel surface of the tooth. So any rinse or anything like that with fluoride in it is definitely a good option. And one thing I forgot to mention is kind of like the order of operations as far as, I get that question all the time as far as like what you should do first. So I always like to say floss first, rinse after that, and then brush as the last step, because the toothpaste actually typically has the most amount of fluoride in it. And that is actually what you want. You want to have the most fluoride stay on the teeth for as long as possible to help give that the best effect and to help remineralize those teeth.
I didn't know that. That's really good information.
I think I do it completely wrong then.
Yeah. Now,
I mean, there's no wrong way. As long as you're actually doing it all, you're still doing a much better job than if you don't do anything at all. So
do you recommend, oh, sorry, Kemal, go ahead.
Go ahead.
Do you recommend an alcohol mouthwash or one that doesn't have alcohol? I'm just thinking about sometimes those alcohol mouthwashes can dry out the mouth a little bit.
absolutely. Yeah. And they both work really well. It comes down to typically personal preference. I know a lot of people like the alcohol one because it has that burning sensation. It feels like it's doing more. And then there's people that are completely opposite that hate that burning sensation. So I would definitely say just more personal preference, but they're both going to get the job done.
So I was just going to ask you about the baking soda. So I know some people are using that, and there are some, I have a lot of friends who are in medicine, and they do actually sometimes advise that to the patients. Is that safe to use the baking soda on a daily basis for dental care?
Yeah. Baking soda is actually kind of like the original toothpaste, I guess you could say. But the biggest thing, more important than actually what you use for your toothpaste or anything like that is actually just the mechanical brushing aspect, mechanically removing that plaque. The baking soda or regular toothpaste, or, like I said, a million different brands out there and types and everything like that. That's all kind of secondary to actually just getting in there and brushing and removing that debris from the teeth, because that's the biggest contributor. Is once that plaque, bacteria, food debris, and all that sits on those teeth, the longer it sits there, the more acid is being released, and it's breaking down the outer enamel of the tooth and causing those cavities. So and irritating the gums and things like that. So very good, very important just to at least get in there. And, even if you don't have anything, just take your finger and kind of wipe it off, to remove the plaque.
So maybe one last question is like how often they should change their toothbrushes, because with the sometimes the danger with the battery operated ones, they get too comfortable and then they don't realize how old it is, and then instead of just cleaning, maybe they're not really cleaning. So what's the recommendation on that?
Yeah, I always recommend about every 3 months or so, just to kind of change it out, get rid, get some new bristles on there, especially if they're starting to get a little raggedy and everything like that, or at least boiling it to help kind of bring some of that, get rid of some of the old bacteria that, gets inevitably left on the toothbrush. But, 3 months is typically a good time frame. So if you think about it, kind of in between, halfway in between your dental cleanings, kind of change your toothbrush.
I think most people don't do it that often. Right?
Yeah.
They don't remember, or they don't realize that's already the 3 months. I think most people don't. Well, this was extremely beneficial for us and for our patients. Thank you for joining us. One thing that we want our patients to, just like any other treatment that we provide, especially with the chronic care, the timely of taking care of their appointments, following up with their doctors, being preventive. And I think this one is maybe one of the most painful ones if you don't take care of your your oral health, the consequences can be really painful. You may be spending a lot of time in the dentist's offices, and this is something that they really should be taking care of. And 6 months, 12 months, regular cleaning should be it should be a must. And hopefully we can help some more patients with this episode. Again, thank you so much for joining us, and hopefully we'll have you maybe sometime in the near future.
Yeah, thank you for having me.
All right, thank you. Bye-bye.
Bye.
Take care.
Night.